The section in our standards which deals with the facilities describes what kind of buildings and equipment are needed to make sure that people with CHD get the right care. When we talked to people about this, we heard lots of different things about how hospitals could do more to support patients and their families when they've travelled from far away. Simple things like information about where the hospital is or where to park. Patients told us it was very important that hospitals are clean and well organised, and that as far as possible the service is ready for the kind of patients which they receive, which means different facilities for children and adults, and as far as possible different things for teenagers who feel like they don't fit anywhere. Many patients told us that Wi-Fi was very important for staying in touch with friends and family, and for school and for work. We were also told that it was important to get some exercise whilst they're in hospital, to be able to eat healthy food, and for wheelchairs to get around easily. So in our standards we have described ways of tackling those things and making sure we get the right facilities, including things we have mentioned such as Wi-Fi, parking and so on. Again, we think networks will be key to this, making sure they work together to get the best facilities and make sure patients can have as normal a life as possible, because it's really tough for families living in a hospital a long way from home and from support of family and friends. One of the most common things we heard when we talked to patients about their experience of care was the importance of good communication. Being spoken to in a language they could understand, being given the right information at the right times, being told honestly whether the local centre was the best place to receive their care. So we heard lots of things from patients about the importance of good communication, the importance of simple and straightforward explanations and support when there are problems. It's always really important that patients and parents don't need to give their case history and say what's happened over and over again to different doctors and nurses. It's important that the information can be used once and passed through the system. Numerous parents said that they were so nervous that they felt they had to stay with their children all the time in hospital because nobody else understood the children as well as they did. So our proposals deal with that and emphasise the importance of having really good information that is passed on effectively. We want every patient to have an individual care plan which sets out what's going to happen to them, and that they should be involved in drawing up the plan that take into account their particular needs. We believe these standards will help ensure that patients, families and carers will have better understanding of CHD and be provided with more information which matters to them, and that they will be helped to be involved in every decision about their care in a way they want to be. When we had discussions with children about their care and with young adults, one of the things they told us they were most concerned about was transition. Transition means change, and it is the change from going from children's service to the adult service. For many people it's a bit scary because it feels like a cliff edge. You get very used to children's services, spending many years being looked after by the same doctors and nurses in very familiar surroundings. Then suddenly you go from the children's service to the adult service and it's very different. Children told us they weren't looking forward to it, adults told us they hadn't enjoyed it, and those going through it said it wasn't much fun. So having heard all those concerns, what we were told was that there are things we can do to make it better. Having a dedicated transition nurses who stay with the patient during the move from children to adult services, having young adult clinics so that teenagers aren't required to attend clinics with screaming babies or older people, having special days to learn about the new service, being able to talk to a buddy who's been through the same process, and sometimes visiting the adult service and meeting the staff before you have to go there for the first time. So all of these things provided the basis for the transition process we describe in our standards. We believe these standards will help ensure that the CHD service in future makes it easier and less scary for people to make the move from children to adult services. As there are more and more adult patients living with CHD, because the population is growing and because more and more patients with CHD are surviving to live full lives as adults, the issue of pregnancy and contraception comes up. We have heard that it is important that there is a close link between maternity and adult CHD services to help adults receive the best support and advice on pregnancy, including the risks and actions they can take to improve their chance of a successful pregnancy. In this section of the standards, we have suggested that women who could have children get the opportunity to discuss the issues with a specialist cardiologist and a specialist nurse. For men with CHD, there is a chance they could pass this on to any children they have, so they need to have a conversation with a counsellor about the possibility of that happening and what it might mean for them. Our standards cover the staff who need to be available to provide the service, and that consideration for people who are considering pregnancy or in the right age range for pregnancy is included in their care plan. These standards will help ensure that patients are better equipped to make informed decisions regarding their pregnancy and contraception and receive the right level of support throughout this period. Very early on in the process, we heard some really concerning stories about what happens to people when they've suffered a bereavement and someone close to them died from CHD. So we've included a chapter in our standards on palliative care and bereavement. We heard that during these times, support is needed by the patients and their families and carers, and it is important that staff are able to communicate in an open and sensitive way. In these standards, we explain how CHD services should help patients and families cope with this really difficult time, what good support looks like, and if someone dies, what follow-up and support will be needed. Amongst other things, this would mean a named doctor and nurse providing close care for families and patients and trying as much as possible to make the arrangements fit with what the patient wants and needs at the end of their life. So our standards set out how care should be organised at this difficult time. We believe that through networks working together we will be able to provide appropriate care for patients and for their families and carers.